I am pleased to welcome everyone again for another session of our 2023 educational series. I just want to go over a couple of notes here before we get started. After Dr. Vandenakker has completed her presentation, we will have time for questions. There's a couple of ways you can ask questions. You can either use the Q&A feature at the bottom of the screen and type in your question, or you may use the raise hand feature, and we will try to get to you in the order that you raise your hand. We also will be recording today's session. That recording will likely be available within a week, and we will put it up on our website as well as our Facebook and YouTube pages. So look for it there. With that out of the way, I am pleased to introduce today's speaker. So Dr. Vandenakker Albanese is a health sciences clinical professor in the Department of Physical Medicine and Rehabilitation at the University of California, Davis School of Medicine. She established and maintained a post-polio clinic at the University of Miami beginning in 1994 and has continued her work with polio survivors at UC Davis since 2001. Her research and publications have focused on exercise, post-polio syndrome, and aging with a disability. And she served as medical advisor to several post-polio support groups. She joined the PHI Medical Advisory Board in 2012 and was appointed to the board of directors in 2015. She serves on committees for the American Academy of Physical Medicine and Rehabilitation, the Association of Academic Physiatrists, and the American Board of PM&R. And with that, I will turn it over to today's presenter.
Thank you, Brian. All right, let me get my screen share going, and welcome everybody. Nice to be here and be able to do this. We will be doing questions at the end, so we will just keep that in mind. All right. Okay, and all right, I think everybody can see my slides now. Nod, Brian, if you can see this. All right. Okay, good. All right, then we will get going. All right, well, exercise. That's what we're going to talk about today. And I'm sure most of you have heard that exercise can be dangerous to a polio survivor. You've heard things like use it and lose it, or muscle strengthening contributes to overuse. And if you are feeling muscle pain, you're burning out motor neurons, that you can't do strenuous exercise. And some of that is true. There's reasons those things got perpetuated, but it's not exactly true. And the truth is there are just as many or more dangers of not exercising as of exercising. And so we're going to talk a little bit about different types of exercise and how you know what's right for you. So I'm going to start with what are the dangers of not doing exercise or of inactivity. And for everybody, polio survivor or not, if somebody is not doing much activity or is immobilized for some reason, stuck in bed for an illness or injury, deconditioning occurs. What does that mean? It means muscles atrophy and get weaker. And it's most pronounced in muscles that are our primary postural muscles. So the spinous, paraspinals, and the lower limbs more than the upper limbs. Those are the muscles we normally use to work against gravity. If somebody is on strict bed rest, there's been studies that show muscles lose 10 to 15% of their original strength per week of bed rest. And over 5 weeks, that can be up to 50%. And of course, strict bed rest isn't often used anymore. I even For most medical conditions, we try to keep people as mobile as possible. So the amount of weakening that happens when you have limited activity is a lower percent of that what we see with the strict bed rest. When people aren't moving, they also can get connective tissue or soft tissue contractures where joints stop moving as well, and they lose bone strength or bone density. So you can see there's a lot of things related to not moving and not being up and around. What are the health benefits of exercise? Well, the big one, and you guys probably hear this from your primary docs, is for cardiovascular health. So inactivity is one of the major risk factors for development of cardiovascular disease. And it works in secondary prevention as far as reducing mortality for people with cardiac disease. If they go through cardiac rehab programs, they can reduce the impact of whatever disease is present. Exercise helps to decrease blood pressure, decrease triglycerides and cholesterol. The bad cholesterol increases the good cholesterol and can reduce risk of blood clots, which can lead to other medical issues. So, how much exercise does somebody need? Well, that is very individual, and especially for someone who's had polio, there's a lot of factors to be considered, and there are risks and benefits. So before starting an exercise program, a medical evaluation is a good idea if you're anywhere over 30, 35. And the kind of the rule of thumb, and this is what a lot of your primary docs will tell you, is that you should be exercising about 30 minutes a day. Now, that is not necessarily true for polio survivors, and we'll get into that a little more later, because exercise is really just on the gradient of activity, kind of normal daily activities versus what is done for exercise. You know, back in the days when people didn't have all the conveniences we have and had to walk everywhere and did a lot of physical labor, nobody exercised for health benefits because they were getting plenty of exercise in day-to-day activities. And depending on what your day-to-day activity looks like, you may or may not need to do a lot of additional exercise. And that is especially true in a polio survivor who is still ambulatory and who may have a fair amount of deficits, so that actually just walking in your day-to-day life is basically the energy equivalent of exercise for somebody who doesn't have physical impairments. So again, there's a gradient, and sometimes exercise is really just increasing the activity you do in a day. The benefits of exercise are dose related up to a point, and that means that there is a ceiling effect, and at some point too much exercise is not better, but most of us don't reach those levels. Exercise is also dependent on long-term compliance, meaning doing exercise today doesn't benefit me next year necessarily. There are some caveat to that, and the exercise you did when you were younger may still benefit you now as far as terms of coordination and things like that. But exercise in general is kind of related to continuing to do it. And so it also has to be part of a lifestyle balance, and having energy for exercise or day-to-day activity versus just maintaining your life and level of function. So all of these are things we have to consider when we talk about how much exercise is right for you. The main components of exercise I'm going to cover today are aerobic conditioning, strengthening, flexibility, and coordination. So let's go into aerobic conditioning. This is what you really think of as cardiovascular exercise. It is a lower intensity, long duration type of activity. So it means an activity you can continue to do over a period of time, not a sprint that you can only do for a very short period and then are too out of breath and tired to continue. But it's an activity that you can actually meet the energy demand of through increased heart rate and respiration. So you're doing enough increase in activity to increase metabolism, but your body can meet that with the increased breathing and heart rate. So aerobic metabolism produces energy relatively slowly, but can continue on an ongoing basis. So when you're conditioned, it's the type of exercise you can do that doesn't overly fatigue you, doesn't produce a lot of painful byproducts in your system, and can be maintained for long periods of time. This is why, there's people that can run ultra marathons because they are meeting that energy demand while they're continuing to exercise. The aerobic exercise is the exercise that really has a lot of benefit to the cardiovascular system. So as far as the heart, what it does is increases the amount that the heart is able to put out by both increasing the volume of blood it can pump and increases overall blood volume, which makes it easier for the heart to put that through. It also benefits the muscles by increasing the number of capillaries that go to particular muscles. There's more capillaries to muscle fiber as far as the ratio. And so that makes it easier for muscles to take oxygen out of the blood. And in the muscles, we have mitochondria, which are the little energy producing structures in the muscle cell, and those increase in number and size as you do aerobic exercise. So it makes the whole cardiovascular system more efficient. So if you do regular aerobic conditioning, it enables you to do more activity. Your body is trained so that you can gradually increase the amount of activity or increase activity that requires a certain amount of energy expenditure. And we usually talk about energy expenditure in terms of METs. A MET, or a metabolic equivalent, is one MET would be what your body uses at rest, and then different activities are kind of the multiples of that. When you do regular aerobic conditioning, that tolerance improves because of the increased efficiency. So day-to-day activities are easier to do. So you can see by this concept that most polio survivors probably should get some degree of aerobic conditioning. Well, how do you do that? So again, one MET is resting metabolic equivalent. Just doing ADLs or seated work might be in the range of 1.5 to 2 METs. Once you're standing, walking slowly, it's going into the range of 2 to 3. Heavier housework, brisk walking, kind of light recreational activities, 4 to 5 METs, and on up. Now, this is a chart that's based on a person with no disabilities, no impairments, no weakness. So I'm sure, as most of you can relate, if you have limitations as far as your muscle strength, or doing some of these activities are more difficult for you, the metabolic cost is going to be higher. So for a polio survivor, it may be that those standing ADLs that are in the 2 to 3 range for most non-polio affected people, instead of 2 to 3 METs, those might actually be more in the range of 5 to 6. So those may actually be exercise for you. So when we try to talk about prescribing aerobic conditioning, we talk about activities that to somebody is more than a resting effort, but of submaximal intensity, can be done repetitively, and it should incorporate as many muscles as possible. The perceived exertion should be in the range somewhere between fairly light exertion to moderate, but it shouldn't be no exertion. It should be something. The general recommendation is that aerobic conditioning is done for at least 20 minutes, at least 3 times a week. But again, that may be different for a polio survivor. So the specifics to a polio survivor is that when you're thinking about doing aerobic exercise, you should use your strongest muscle groups as much as possible. And those are the ones that should be used for any repetitive activity. You also have to be careful that whatever exercise you choose to do does not increase stress on weak muscles or overstressed or unstable joints. Often you have to consider doing a non-weight bearing mode of exercise. Your doctors will often encourage weight bearing exercise because that helps more with bone density and does require more energy expenditure. But for a lot of you, non-weight bearing is actually safer and it is something you can do easier than weight bearing exercise. For polio survivors, my recommendation is always that you start well below the suggested intensity. So if you're told to go walk a mile, whatever, you're going to start with much less than that. Or if you're told to start with half an hour of exercise, most of you are not going to start with that. You might start with 3 minutes, 5 minutes. You have to see what you tolerate and start there. And then the frequency also. Again, the at least 3 times a week may be too much. Often if you're starting in a physical therapy program, your therapist wants you to do something every day. That may be too much. And we'll talk about how to judge that. Sometimes to accomplish enough aerobic exercise to benefit the heart, you can increase the amount of time you're doing exercise by using rest intervals or pacing, as we do for the fatigue symptoms. So you might exercise for 2 minutes, rest for 2 minutes, do a little bit more, and thus be able to increase the time you're exercising by not doing it all at once. Any progression in exercise should be very, very gradual. That's a good rule of thumb for everybody to prevent injuries or other, excessive muscle soreness, that sort of thing, but especially for a polio survivor, any increase should be very, very slow and always with monitoring of symptoms for overuse. So let's go into strengthening exercise. So strengthening is what we do to try to increase the strength of not just muscles, but ligaments, tendons, connective tissue, and bones by providing stress to those structures. And by stressing or increasing demand on those structures, it actually increases the strength of the tissue. But it does so by causing some breakdown of tissue, which then remodels and regrows stronger. So it's very, very easy with strengthening exercise to overdo and overstress. And if you overstress or overwork and those tissues are not able to regenerate and reform and become stronger, it'll result in deterioration, weakening, and injuries. So this one you've got to be very careful with, especially as a polio survivor. How does the body adapt to strengthening exercise? Well, not just by strengthening the muscles and connective tissues, but there's also changes in the central nervous system where your nervous system learns how to better activate motor units together in synchrony and faster. So not just is the actual strength of the muscle improved, but just the function of the muscle by improving that nerve muscle connection. We also see an increase in the size of muscle fibers. So even by not increasing the number of muscle fibers, the muscle fibers that you do have will be increased by increasing protein and number of fibers. So in addition, just like with the cardiovascular exercise, we see increased number of capillaries. Your body's very good at adapting to providing more nutrients and oxygen to areas that need it. We also see increased thickness and strength of ligaments and connective tissue, increased density in bone and cartilage. So this can be helpful in those areas that you're able to do it. So the basics of a strengthening exercise program is what we call progressive resistance exercise. So we provide resistance to a muscle, and sometimes that might just be gravity as resistance, or it can include bands or weights. Exercises are done in sets of repetitions with rest in between. This is typically a type of exercise where a muscle will fatigue and need rest. It's not like the aerobic exercise that you should be able to keep going more consistently. The intensity that you start at when you're doing strengthening is determined by what the maximum strength is. So a muscle that's very strong will start at a much higher level than a muscle that is weak. A muscle that is large will start with more stress to it than a small muscle. And then the volume of exercise will be increased gradually. This, again, this is a type of exercise that carries more risk than your basic cardiovascular exercise. So it definitely has to be individualized. How people respond to strengthening exercise can vary depending on number of muscle fibers. So a polio affected muscle will not have the same number of muscle fibers. It also varies depending on genetics. Some people are able to build muscle quicker and faster than other people. And so you may have a sense on where you are on this scale. Some people, they could work really hard and are never going to develop big muscles. Other people, it seems like they do almost nothing and they increase their muscle size. Use of a personal trainer for this can be very helpful because, again, you're targeting different individual muscles differently. But for polio survivors, you want a personal trainer who either has some knowledge or familiarity with polio or is willing to listen to you and learn a little bit and work very specific to your body. So if you're going to do a strengthening program, how do you know which muscles you should be targeting? Well, for all of us as we get older, and especially for a polio survivor, you want to pay the most attention to muscles that are functionally important. So what is it? What activities do you feel like you need more muscle strength for, or are getting more difficult to do? So what muscles may impact that? Certainly core and postural muscles are important to just maintaining function. But also kind of what are the things that will benefit you the most? And this is where a physical therapist may be helpful in helping you decide what you need to work on. And then there's different types of strengthening program as far as what you're doing with the muscle. We were talking about isometric, isokinetic, eccentric. These are different types of strengthening. So isokinetic is what we probably think of as the most classic form of strengthening. Would be like doing biceps curls or bench presses, just strengthening a muscle through a range of motion. But sometimes we want to work on with just isometric strengthening, and that's contracting and holding a muscle without any movement of a joint. That's especially helpful for areas where you may have a joint that's painful or arthritic or doesn't have motion for some reason. Eccentric muscle action is strengthening while the muscle's lengthening. So meaning you're going against what the muscle is designed to do. So say in the example of a biceps curl, it's not the action of bringing a weight up to from an extended arm, bending the elbow up to the shoulder. It would actually be supporting that weight and slowly bringing it down and controlling that extension. So the muscle is actually lengthening and resisting gravity that way. When you're looking at strengthening programs, sometimes you want to be targeting areas that have had an injury you're trying to recover from and regain strength. Sometimes you have a weak area or an unstable joint that you actually want to avoid and not stress additionally. So again, very careful consideration of what to target. The components of the program are going to be how many repetitions can you do and how many sets. So we often talk about multiple sets for people, but for a polio survivor, sometimes just a single set is where you're going to start, and maybe just a few repetitions. Again, we're starting with less than the recommended amount in general, and going to be very careful about how much we increase that. So you want, if you're doing more than one set, you're going to have a rest period in between. And how many repetitions you do in that set is kind of depending on whether you're working more towards strength or endurance. For maximizing strength, it's often lower reps at a higher percentage of your maximum. For working on endurance, it's usually a lower percent of maximum, but more repetitions. How fast you do the repetitions determines whether you're working toward improving power as well as strength. That may or may not be applicable in what most of you are trying to achieve. And with all of the strength training, you're going to have some breakdown of tissue, especially if you're doing the more strength focused rather than endurance focused. And so the rest period between workouts is really important. That means you typically don't do strength training every day. You may have a day or two or three or even a week in between when you're working on strengthening. As you get stronger, you might be able to increase that frequency, but rule of thumb is you usually have at least 1 day rest in between. What a lot of people do if they're really into building strength are split programs, meaning 1 day you may work on upper extremities, another day lower, so you're not working on the same muscles every day. So for polio survivors, you really want to set very specific goals for functional gains. You're not working on strengthening a muscle just because it's weak. We use different grades for muscles. If muscles are so weak that they're really not helping you functionally and they don't really have the potential to become functional, you don't really need to work on strengthening it. You really are going to focus on those that are going to affect your function. You really want to be aware of which muscles are at risk of overuse, which joints are at risk of too much stress and exacerbating degeneration in joints. If you have body mechanics or joint positions that are altered because of imbalances or joint deformities, you may be better off using the isometric strengthening, where you're just contracting muscles, rather than your typical isokinetic, where you're actually moving through the range of motion of a joint. Your polio affected muscles are definitely going to require longer rest periods to recover between any strengthening sessions. And again, like with any exercise, you're going to be very, very diligent about monitoring for overuse and making sure you adjust those rest periods if you do see any symptoms of overuse. All right, flexibility. This, here we're talking about the pliability or the elasticity of muscles, connective tissues, tendons, and ligaments. And to maximize a muscle's function, we want really an ideal range of flexibility. So we don't want that muscle too stiff, but we also don't want it too lax. So when people are put on stretching or flexibility programs, it's really to restore or maintain that full range of motion of a joint. And identifying restrictions in motion that may function or stress other tissues is important to identify how much stretching you need. If connective tissue isn't regularly stretched, it will gradually shorten, especially as we get older. Things tend to get stiffer and shorten more readily. And genetics, again, play a role in how flexible somebody is. Gender, age, temperature can all affect flexibility. Now, and as I said before, excess flexibility is not necessarily, is not beneficial and actually can put joints at risk. We see flexibility, this in my next, nope. Let's see if I can go back. Is especially important in a polio survivor who have muscle function around a joint where one group of muscles that move the joint is stronger than another. And so often when you see this muscle imbalance around a joint, the stronger side will tend to shorten or tighten up because it's not adequately opposed by the opposite action. An example of this would be if you have weakness of the muscles that pick up your foot, and so you have some degree of foot drop, but your muscles that push down the foot are pretty strong. What often happens is those the heel cord or the gastroc, the muscles that push the foot down, will tend to shorten and tighten over time because they're not resisted as much as normal by the opposite action, and that will contribute further to a foot drop and may impact gait and cause more tripping over the toe, and sometimes just stretching out those muscles that are stronger help to decrease the amount of functional foot drop that a person has. So stretching exercises, most of you are probably my age or older. Growing up, we saw a lot of stretching that was what we call ballistic or bouncing, where you tried to stretch by kind of bouncing to the end of a range of motion of a muscle and kind of push past that. Well, then we figured out that ballistic stretching is, although effective, also puts people at the greatest risk of injury. So now the recommendation is more static stretching, where you go to the end of the range, just hold it, try to go a little further, but very slow and controlled, where you're holding for about 15 to 20 seconds, then relaxing, trying to go a little further, and just doing a few repetitions, not the multiple bouncing. You can also do neurofunctional stretching, where you're pushing to a point, then having something actually push against that, try to hold it there, relax, and then go further. And a therapist will use that a lot of times to help you develop a stretching program. So for polio survivors, with stretching, we don't worry about muscle overuse, but we do worry still about muscle damage. So definitely we want to encourage static stretching as the safest method. You typically want to warm up a muscle before stretching, or if it's a muscle that it's hard to warm up, at least warm water, warm bath can help. You'll get more result if the muscle is warm. As I mentioned, muscle imbalance around a joint will lead to loss of motion if you're not stretching that stronger side. Do bear in mind, especially those of you who had surgeries, bony changes, joint changes, fusion of joints may be contributing to loss of motion. So if something just isn't moving, don't force it because you can result in a fracture. And if you have a very lax joint, you don't want to stretch around that joint because you can actually do more damage to the joint. All right, quick word on coordination and balance. This is really exercise geared toward improving proprioception or awareness of the position and movement of body parts. In general, polio survivors actually have very good proprioception and may be more aware of body movements than kind of your average person off the street. But this can change. Your body's response can change because things change as we get older and people develop arthritis, lose range of motion, may develop neuropathies that actually involve losing some sensation, which makes the coordination and balance a lot harder. So there are certain exercises geared toward improving balance. And focusing again a lot on postural muscles, which also contribute a lot to balance. Sometimes using external stimuli for proprioceptive feedback can be helpful in this type of exercise. All right, so when you're being assessed or talking to somebody about what kind of exercise is right for you, a lot of it will have to do on what muscles were affected by polio and to what extent. So you may have in your body, you might have some muscles that are being overused and overstressed that you actually have to do less with, and you may have others that need more exercise, more strengthening, that sort of thing. So the assessment is really important. I like using a scale that was developed by the National Rehab Hospital, Dr. Halstead's group years ago. That kind of gives a good rule of thumb, and it classifies polio muscles into class 1 through 5, 1 being no polio, and class 5 basically severely affected non-functional polio muscles. So a class 1 muscle, which is no clinical polio, normal strength as far as you can tell, you can use those muscles to work on increasing strength, improving cardiovascular endurance, so use those for aerobic exercise. And typically you could probably exercise those muscles 3 to 4 times a week for 15 to 30 minutes without any problem. But again, you're going to watch for symptoms of overuse, and stretching can pretty much be done with any muscle. A class 2 muscle, these are muscles that you may or may not know if you had polio in that limb, but there is evidence there was some polio involvement, so they're don't quite have the same endurance as a normal muscle. Here your goal is going to be to maintain strength more than try to push strengthening. They also can be used for your aerobic conditioning program, but you're not going to use them quite as often, maybe up to 3 to 4 times a week, probably no more than 10 to 20 minutes. And you're going to think about pacing activities with having rest intervals in between, definitely continuing to monitor for signs of overuse. A class 3 muscle is a polio affected muscle, so a weaker than normal muscle, but that's clinically stable, meaning you haven't noticed loss of strength. Here again, you're really going to work more at maintaining your strength rather than trying to gain anything, unless you know that muscle recently weakened because you hadn't been using it for some reason. You want to make sure you're maintaining your range of motion in that muscle, and any strengthening program is going to have to be a modified program with pacing and resting in between. And you may want to use mostly non-weight bearing if we're talking about lower extremity muscles. The class 4 muscles are those that are clinically unstable or developing new weakness. So here you want to prevent further weakness, but if you suspect that you're losing strength or your healthcare provider thinks you're overdoing, you actually are probably going to decrease use of that muscle rather than trying to do any sort of exercise. Sometimes you lose strength though because something hasn't been used enough. So if rest doesn't help as far as regaining some function in a muscle, you might start with some very gentle exercise to see if that helps. So start with just range of motion, non-fatiguing, gravity eliminated exercise, and monitor, does that actually improve function, maintain function, or make it worse? The class 4 or 5 muscles, the very atrophied with very little function, really there you're going to just maintain range of motion. You're going to be able to use those a little bit in the pool or gravity eliminated, but not really target them as far as an exercise program. So what are those signs of overuse you're looking for? Well, any fatigue that lasts more than a few hours after the activity, I would say you're doing too much. You should be able to, if you're doing an exercise program, go home, rest, take a nap maybe, but you know, a few hours later, you should feel back to normal, not wiped out for the rest of the day, certainly not into the next day. If you feel weaker after the activity, if like you can do less later that day or the next day, bad sign. The muscles are painful. Again, that's overstressing, breaking down tissue. If you have a sensation of muscles cramping, twitching, crawling, again, signs of overuse. And sometimes these overuse symptoms don't come on the same day. They may come on a day or two later. And so a lot of times if people are starting out on an exercise program or trying to decide, are they overusing or underusing muscles, I have them really journal their activities as well as their symptoms to look for patterns. Because sometimes when something doesn't, a result of an activity doesn't come on for several days, you may not remember what you did a few days ago that may have overstressed a certain muscle group. So kind of additional advice for polio survivors: in general, low impact, gentle exercise is best tolerated. This is kind of true for everybody as they get older. I'm going to say not just polio survivors. So which is why we often talk about using aquatic exercise, things like Tai Chi or adapted yoga that really doesn't have a lot of impact involved. You all know that you understand your body better than anybody else. So when you're working with, whether it's a therapist, a trainer, or talking to your PCP, don't be afraid to speak up and say, hey, I just can't do that, or that hurts to do that. Give feedback and don't let anybody bully you into doing something you know you shouldn't do. Developing an exercise program will almost always require trial and error. So it's a matter of try something, see how your body responds, go from there. That's why we talk about starting slow, progressing slow, because you don't want to make big errors. You don't want to do injuries that put you back for months. You know, want to keep it to where, okay, I'm a little too sore or a little too tired. Let's back off a little bit. That's the reason for being kind of so precise and careful. And do know that your exercise needs and tolerance are going to change over time. Things in your body change as what you're able to do mobility wise changes. What you need to do exercise wise will change. And a good example of that is if you're going from being ambulatory a majority of the time, where you may be getting plenty of exercise, just getting around the community, doing your normal activities. But if you go from that to using a wheelchair or a scooter, and all of a sudden you're walking a lot less, you may actually need to add some exercise again, very controlled and specific, but you might need to add some exercise to your daily routine to counteract that what you're not getting from what you're doing mobility wise. All right, in summary, exercise is not the enemy, but it shouldn't hurt. But on the other hand, it's not necessarily easy either. We want gentle exercise programs, but it is going to be a little bit of work. It definitely has to be very individualized. And that's probably one of the most unique things about polio is that there's no standard recommendation for a polio survivor because everybody's different. So getting a medical assessment before starting is important. Now, that is most important to just make sure your heart and lungs are fine, to stress. As far as finding somebody who really knows the ins and outs of polio and what you can and can't do, I know that's harder to find somebody with experience. There are some resources available through PHI, and we have therapists that are always willing to talk to a therapist you're working with, or our physicians. So just know there's help available if needed. Most importantly is that you know your body and you know its signals, and you pay attention to that. But exercise performed with the right prescription, instruction, and technique can be beneficial and improve function and well-being. And I think that's the end. There we go. All right.
Okay, thank you very much. We will open it up for questions now. So like I said, I see a few of you have typed in questions to the Q&A feature, but you can also hit the raise hand feature and we will get to you that way as well. So let's see. Janice asks, I'm 71 and noticing decreased strength in my polio affected limbs. I see a PT twice a week for strengthening work. She says I'm gaining, although I don't really see it. Ought I be concerned?
Well, so what it sounds like is if the therapist says you're gaining, you're not so sure. I would say you may be gaining slowly, you may be maintaining. Therapists are sort of pressured to say you're gaining and making progress because to justify continuing therapy, they need to show progress. So even if it's really, really slow, which is pretty typical in polio affected muscles, that it sounds appropriate as long as you don't feel like you're getting weaker. If you're having muscle pain or feel like you're actually getting weaker, that's when you need to tell the therapist that you need to back off.
Okay. Janice H asks, I wear my AFOs and PT. Is that okay?
Yes, actually very important. I'm glad you asked that because I oftentimes we actually we definitely want people wearing their bracing. What the bracing does is help to protect a joint that's unstable or at risk. So it's very important that and often sometimes adding bracing enables people to do more and exercise more. So yes, important to use your braces.
Okay, I see that Flor has her hand raised, or Jill has her hand raised. I'm gonna open that up for her.
All right, can you hear me?
Yes.
Yes. Mm-hmm.
All right, right now I'm dealing with a total knee replacement revision. And the exercises that I have to do obviously are painful in order to regain the use of the leg. I do use a scooter for any reasonable distances. And I also use crutches. I go to Spalding Polio Clinic for a year and a half to get measured. And I'm a little concerned about these exercises I have to do. When I had the original knee replacement, I got through them and I got total range of motion and everything. Right now, they seem to be extremely painful, but if I don't do them, twice a day, I'm afraid I'm going to be in trouble. How do you modify that?
Well, so it's a little bit different when we're talking about post-surgical rehab, because it may be that, so if the pain that you're getting is more in the
It's in the muscle.
so are the muscles sore, or is it more the tendons, connective tissue that's painful?
No, it's the muscle because I have to build up my quad in the thigh.
So if they're aggressively having you strengthen the quad and the quad is painful, they're probably too aggressive. You'll probably have to strengthen that slower.
Okay.
There's a lot of component of pain after a joint surgery that is in just the connective tissue getting range of motion back. But I'm talking about sort of passive range of motion, not necessarily what you can do actively. So it's normal to have that connective tissue pain as you're stretching those tissues, but you shouldn't have a lot of muscle pain. Then they're trying to strengthen the quad too aggressively.
Okay, thank you.
You're welcome.
Okay, actually received this question via email prior to today, but so I'll read it. Michael H asks, medical providers regularly ask patients if they are getting 150 minutes per week of moderate exercise. Is this a reasonable goal for polio survivors? Or to put it another way, should the term moderate exercise be broader for polio survivors to include stretching and range of motion exercise?
Quite possibly. And in fact, for polio survivors, walking around the house might be exercise. Again, it depends on what your mobility status is. So yes, often the recommended amounts is too much. And so you really have to kind of figure out with your body what you're able to do without overdoing.
Okay, I see Flora has her hand raised again. I'm gonna open up her mic. Go ahead.
Thank you for the beautiful presentation, Dr. Vandenakker.
Thanks, Flora.
Hi. My question is burning a sign of muscle fatigue? Because I will wake up in the morning, both my lower legs, the calves are burning. I will move around the apartment, and after like 2-3 hours, I won't feel it. There are days that I will feel it, the burning, the whole day until I go back to sleep.
Yes,
what am I doing wrong?
That's probably muscle fatigue.
Okay.
So you need to kind of look at how much activity you're doing, and kind of figure out where your limits are, where you need to cut back.
Yeah, Cynthia and I talked about it, and she reviewed my steps for each and every day the last month or so, and I need to cut back, like you had said.
That's what it sounds
as well.
like. Yeah.
Thank you very much.
Sure.
Okay, thank you. Let's go to Eric. Eric, go ahead.
Eric, you're still on mute.
Can you hear me now?
Yep.
Okay, sorry. My right leg was severely affected by polio. I wear a KAFO on that leg. But my left leg, which I thought was not affected by polio, to an increasing extent, just the knee gives out. It just buckles. And I've noticed, it just buckles and sometimes drops me on the floor. Are there any exercises that I can target for that problem?
Is there any knee pain that occurs with the buckling?
No, not until I hit the floor anyway. No.
Okay. Okay. that's going to be one of those trial and error things. It sounds like you probably have quad weakness in your good leg. A lot of polio survivors, the good or normal leg does have some polio effect as well. So you may start on some quad strengthening exercises and see if the muscle can strengthen, but it's also just as likely that muscle's being overused and you have to cut back.
Okay, I understand. Thank you.
Mhm.
All right, I'm going to go back to the Q&A. Richard asks, he says, I'm 85 years old and my left leg is a class 5, but my right leg is about a 2. I'm afraid of weight training for my right leg as I'm afraid of losing the strength I have. I have ankle weights that I was using on my right leg. Is that appropriate exercise for my right leg?
Okay, but tell me
I
again,
keep losing some of the sound, and I had gotten a message. Oops. I should.
Which was the polio affected leg? I'm sorry, Brian, I don't see this question.
Could you do a question?
Brian, can you repeat the question? Brian, you're on mute.
Apologies. He says he's 85 years old and his left leg is a class 5, but his right is a 2. And he's afraid of weight training for his right leg.
I would agree.
Okay.
And so what was he doing? What was the
He
exercise?
has ankle weights that he uses on his right leg, and he's asking if that is appropriate exercise for the right leg.
If the right leg is not having symptoms of overuse, that's appropriate. But if it's fatiguing or having any sort of muscle cramping, twitching, pain, then it may be too much. Can we go to this one, Ron's question about the bulbar polio and the stomach and heart muscles? Do you see that?
Let me scan for that real quick. In the meantime, I'm going to let Charles go.
Okay.
Then we'll come back.
Hi, I'm a polio survivor. My right leg has been more severely affected by polio than my left leg. I've been falling quite recently, several times during the last month. That's when I've been walking. I exercise sitting down 3 times a week. My question basically is, who should I go to get advice on trying to avoid these falls?
You go to, so I guess my recommendation would be a physical medicine and rehab doctor who could kind of look at what's causing the falls and help you problem shoot there. Do you feel like the falls are because your legs are getting weaker?
Yes, I as I walk, I sometimes, well, let me first say, I walk prone. I use a rollator.
Okay.
And walking prone, I think my leg catches the floor and I trip. So
Okay. Somebody will need to look at your gait mechanics and see what can be done to help you with that.
Okay, thank you.
Okay, I think the question you're referring to earlier was Ronald. He says, I've had bulbar polio and breathe mostly using my stomach muscles. Will exercise wear out my stomach and heart muscle prematurely? I recently developed a rapid heart SVT condition, and so I'm taking diltiazem for that. Do you think post-polio contributed to this condition?
So, so no, I don't think the polio contributed to the heart arrhythmia and condition. And polio does not affect heart muscle. So so exercising won't wear out your heart prematurely, but your stomach muscles that you use to breathe, it may be that at some point they get so weak that just breathing is overusing them, and you may need assisted ventilation in that circumstance. So just wanted to cover that one. Thanks, Brian.
All right, I'm going to open up the mic for Sandy. Sandy, go ahead. I think you're still on mute.
Can you hear me now?
Yes.
Okay, that stupid commercial. Can you hear me now? Okay, I have actually two questions. When you refer to the muscles being affected by polio, that always throws me because I have, say, some severe places where I'm crippled. For example, I have the typical polio hand. There, I see it on other polio survivors. My right hand I can barely use. My left arm I can't raise above my head, but my whole body is weak. So as I've been progressing, unfortunately, with post-polio, it's affecting my entire body. I can't walk more than 50 feet. I'm weak. So,
Yeah.
So what do you mean by polio affected muscles? Aren't they all affected?
Well, they're affected to different degrees. And it sounds like you might have all your muscles affected. Not everybody does. Some people just have one limb affected or certain muscles. So everybody's different. You may, and the polio survivors I see that have the biggest problem with fatigue are the ones who had very diffuse involvement, but to a mild extent. So they thought they had maybe, a lot of normal muscles and limbs, but they really aren't. They were in that classification we talked about, kind of in that level 4 where they seem normal, but they were affected by polio. And often that doesn't really become evident till they get older.
Well, it's a kind of a two-part question because I'm a recent widow and I'm realizing now painfully how much my husband did for me that I just took for granted. So it's starting to concern me that I walk, but very short distances, maybe 50 feet.
Mm-hmm.
Eventually, I'm wondering if I'll get weak enough that I may have to be in some kind of device all the time. So I use a scooter, but here's my second part question. I'm going to Los Amigos Rehab Center next month. They're going to do an evaluation in Downey. And are braces something that someone who's getting weaker, that I never wore braces, but is it possible that braces would help me walk, or is that just going to make me worse?
That really depends. In your case, it sounds like it may be more fatigue, in which case bracing is not likely to help. If it's more a matter of one, there's so much that goes into that. You need the assessment.
Okay, I'll do that. Thank you.
Okay.
Oops, I'm sorry about that. Thank you.
Sure.
Okay. I'll go back to the Q&A real quick. This question is from Saul Morse, who we know quite well.
Hi,
He
Saul.
says, hi, Carol. I participated in an academic study of seated Tai Chi in a program developed for people with arthritis. Do you have any thoughts about this for those with PPS?
Definitely. I think Tai Chi is actually a really good form of exercise for a lot of PPS, as yoga can be as well. Typically often needs to be modified, especially yoga, because of the balance issues, but both of those are good forms of exercise in general. And I also recommend a lot of different seated or chair-based exercises. Again, I always tell my patients my number one goal is to prevent falls, because those just cause lots of additional problems and can really severely impact people's mobility. So exercise is good, but it has to be safe.
All right. I'm going to open up Maureen's mic. Maureen, go ahead.
Hi, Dr. Vandenakker. Always wonderful to see and hear you.
Hi, Maureen. Thank you.
So my question is this. I've heard, and even from people in my support group, that using a scooter with their arms always outstretched in front of them contributes to the weakness in arms. And since I heard that, and when I know of people who are using that, I often suggest that because their arms are always out in front of them instead of by their hips, resting with the joystick, that perhaps a power chair of some sort would be the better choice, especially if the upper body limbs have or have not been affected by polio, because as we know now, polio goes in the mouth and it goes everywhere. What do you think?
I think it depends on the person. I think if their upper extremity function is still good and doing the scooter may actually provide a little bit of exercise with the upper extremities and they're tolerating that fine, then it's no problem. I think for somebody who has significant upper extremity weakness, then in general, the power chairs are much better.
Thank you.
Sure.
Okay.
Brian, I want to
Yep.
address Terry's question a minute. Terry Shaw here.
Mhm.
When I walk, my legs hurt a lot. What can I do? Or what cardio can I do? So I am going to say that that is not necessarily a cardio issue. You definitely need to be evaluated. There's a lot of things that can cause leg pain with ambulation, anything from joint arthritis to stenosis in the spine to a blood flow thing. But there are other medical conditions that can cause leg pain when you're walking. So that needs to really be thoroughly evaluated.
Okay. All right, let's go to Diane.
Hi, thank you so much for your presentation. I'm at a quandary because my stomach muscles and my torso muscles are very, very weak. I was paralyzed from the neck on down when I was born with polio. My mother got it right before she had me. So I have a back brace that I used to use to keep me upright. I was a performer, a singer, and they said, now don't use your back brace. My scoliosis is rather severe, but it's been stable. At this point, I'm going to be 70. It's increasing. I have not worn my back brace because they say it'll weaken your muscles if you use it too much. Should I use the brace now that my muscles really are getting weaker, and maybe the back brace would kind of help me stand me up just a little bit straighter for short periods of time?
Yes. So you hit a good point there, and it gets back to is a muscle getting weaker because it's post-polio, or is it getting weaker because you're using it too much, or is it getting weaker because you're not using it? Right. Obviously, you've been trying to use it. You are getting weaker. It's time to use the brace to help to compensate for the weakness.
Thanks. Thank you.
Okay, let's go to Nancy. Nancy, are you there?
Can you hear me?
Yep, now we can.
All right. I'm 80 years old. That's the reason for this voice that sounds so awful. But I also have, in addition to the post-polio, I am a Parkinson's patient. Polio says restrict your activities and monitor them closely. And Parkinson's says exercise, exercise, exercise. Would you care to comment?
Well, I think as we talked about today, even though with polio, you want to be careful how much you do, you still want to maintain as much exercise as you can. So it's a hard balance. And I think you should try to do as much exercise as you can. But of course, with the polio, that's going to be less than maybe the typical Parkinson's patient, but definitely we do want to keep you moving and doing as much as you can, as long as you can.
Thank you so very much.
But you do want to explain to your Parkinson's therapy programs that you have the polio as well.
You bet.
Mhm.
Okay, I think we have time for just a few more questions. Let's go to Arlene.
Okay, can you hear me?
Yep.
Hi, Dr. V.
Hi,
I'm
Arlene.
a patient of yours. You remember me?
Uh-huh.
Okay, it's been a few years. I've had a new development in the last couple of years. I've been diagnosed with lymphedema.
Mm.
So this has really put me back a little bit. I haven't been able to wear my leg braces. I had a KFO and an AFO. So now I've been in my power chair. So I feel like I've really been getting weaker. And in fact, I've been driving to UC Davis back and forth a lot because I'm going for the physical therapy with the PT there. Dr. Chi is the one who diagnosed me with lymphedema. And now I'm going to be seeing Dr. Salibian. In fact, I think he's in your building next month. And I just want to get back in braces so I can walk a little bit and get some exercise. And I just wonder what your opinion is on this.
So where are you with the lymphedema therapy, and how well controlled is the lymphedema?
Okay, I'm wearing support hose, but this is another problem because she had me wearing the 20 to 30. Well, the arthritis in my hands is so bad that putting those stockings on just made it so painful that I've gone down to wearing the 15 to 20. So I think it's really reached its plateau. And I'm
So
wondering,
then Arlene, it's time to see me again and see if there are any bracing we can do for you.
okay, that's what I wanted to ask too.
Okay.
So I think maybe after I see Dr. Sullivan, then I'll make an appointment with you.
Okay.
That's what I wanted to ask you. Yeah. Okay, I'll see you soon.
All righty.
All right, I'm going to go to Peter because I saw you had some questions in the chat as well. Peter, are you there?
All right. Can you hear me?
Yes.
Yes.
Okay. So I was interested in figuring out if adding a brace would improve our ability to do proper exercise and, or just sort of borrow energy from other muscles that will then be compromised.
That's not specific enough question to answer.
Like I have decreasing strength in glutes and no quads whatsoever. And I need some more stability, perhaps help with a brace. But if I add a brace, will I be just borrowing from other muscles that are already weakening instead of just leaving it off?
Well, not necessarily. Sometimes a brace can if it stabilizes, an unstable joint can enable somebody to do more exercise. So again, without seeing you, I can't say specifically in your situation, but there are definitely times a brace enables someone to be able to accomplish more exercise.
Okay, thank you.
Okay, I think we have time for about one more question. Let's go to Robin. Robin, are you there?
Yes.
There you are.
Okay. Can you hear me now?
Yes.
Okay. I began having post-polio symptoms beginning in about 2009. And I had originally, they thought I had polio only in my right leg. I also had some problems with my left hip from birth. So I was in casting and all sorts of things for the first 3 years of my life, and then got polio at about 3.5. Beginning in about 2009, I started having fatigue and also having more shortness of breath. And so I finally this past week went to see a pulmonologist, and she clarified that there was nothing like COPD or anything like that going on, but didn't think that polio had anything to do with my shortness of breath. But it's gotten so bad that I can barely walk a block, even with either a walker or a cane. And what she wanted me to do was to strengthen my lower leg muscles more. And I'm in PT, which is helping with that, but I don't want to overuse, especially my right leg. Is it possible, as you were talking to somebody a little earlier, that perhaps since I'm feeling weakness in a variety of places, that maybe the polio was more extensive? I know we think maybe I had lumbar polio because I had a funny thing happen, a brain thing happen in 2011 that was sort of stroke-like, but affected nerves that would have been just to my mouth, and I have begun developing some swallowing problems. So I guess I'm just asking, is it possible that all of this is polio related? And is the breathing issue for walking something that could be related to polio?
So I would say, I'm not going to say it isn't, but I think if you haven't had a more extensive medical workup, there's a lot of other things that could be contributing that need to be evaluated for. So I would certainly, it's not a typical polio presentation. So I don't know if you've had, your heart evaluated, had a thorough neurologic evaluation. There are other conditions that could cause that.
Okay, the heart seems to be good. And as she said, the lungs seem to be good. So I haven't been near a place where there's a doctor with good credentials for this, but I will then look into getting an evaluation.
Okay.
All right, thank you.
You're welcome.
All right, we're just about out of time for today. I appreciate that there were many of you that probably still had questions. There's a couple of new features that we've rolled out recently that I wanted to highlight. One is the new Living with Polio section on our website. So you can go under our education tab, go to that new section and search for information by category. If by chance you can't find an answer there, we also have a new Ask the Doctor feature, which you can access directly from our homepage. Go to the forum, type in your question, and one of the members of PHI's Medical Advisory Committee will attempt to at least answer your questions, if that's possible. And so there's a couple ways we can address that, or you can always just send an email directly to us, and we can get you an answer that way. I wanted to thank Dr. Vandenakker today for volunteering her time and expertise. We greatly appreciate it. I'd also like to thank the Christopher and Dana Reeve Foundation for their generous sponsorship of our educational series. If you'd like to support PHI or programs like this, you can go to our website and click on the donate button at the top of the screen. And then finally, I just want to thank all of you for joining us today. Keep an eye out in your email for more information on next month's lecture, which will take place on August 22nd. And the topic of that talk will be accessible travel, and we will be joined by the author Candy Harrington. So once again, glad you all could join us today, and look forward to seeing you next month. Thank you.
Thank you.